Government Order of the Day number 1.
New Zealand Public Health and Disability Amendment Bill, second reading.
Honourable Tony Ryle.
Mr Speaker, this is the second reading report back of the New Zealand Public Health and Disability Amendment Bill that's come back from the Health Select Committee, and I'd like to acknowledge the contribution of members from all sides of the House towards that bill. The bill proposes legislative amendments necessary to support the improvements following the recommendations of the Ministerial Review Group earlier last year. It would be fair to say this is not a major restructuring of the health service. This is really about trying to get the health structure working more effectively. The proposed changes represent a major drive to better value for money in our public health service, to enable greater national and regional cooperation in the sector, and to reduce duplication and bureaucracy. And the changes enable us to improve efficiency and move resources to improve frontline services. The main provisions of the bill are a new objective for district health boards to seek most effective and efficient delivery, which is a way of ensuring that we move beyond the silo mentality that is such a fixture of so much of anything that central government does, in order to ensure that we meet both our local, regional and national health needs. It has new functions on district health boards to collaborate, to work together to ensure the most effective and efficient delivery of services to meet those different levels of community needs. As the House will be aware, the Government has also established a shared service organisation, Health Benefits Limited, to harness the power of bulk purchasing and procurement and supply chain in order to free up cash that could be used elsewhere in the public health service. And fundamental to that is the ability to ensure that the major participants in the public health service, the district health boards, do assist in that cooperative approach, and where there are roadblocks to that happening, that there should be ministerial direction that is transparent to enhance the government's ability on behalf of taxpayers to ensure greater system collaboration and the use of shared services. It also provides for a new planning framework. The bill amends the current requirements that district health boards have a reporting structure that involves, statements of intents and annual plans and district annual plans, and so much of which is duplicated and not really read by participants. And we need to streamline that reporting process, but we also have to take into account the fact that we're moving towards a more regional cooperative approach in the way that district health boards work, and that needs to be facilitated in the whole reporting infrastructure, needs to be slimmed down, the duplication removed and made much clearer. Very strong consensus, Mr Speaker, across the health service for the establishment of a Health Quality and Safety Commission to advise the government on health epidemiology and quality assurance matters, to determine quality and safety indicators, and to promote better support and better quality in health and safety. And we know that if we can improve the quality of the care that people in our public services, public hospitals receive, like making sure they get the right medication, making sure they're seen at the right time, making sure that tests arrive in the right format, not only does that mean that people are treated better, recover better, get home sooner, it does mean that we save money that can be used elsewhere in the public health service, and that will be a very significant role for the Health Quality and Safety Commissioners to work with the sector to provide better quality services really right across aged care, primary care and our public hospitals. The bill also provides the power to appoint elected district health board members to other district health boards, which is consistent with trying to use the very best people that we have in the public health service to meet our objectives. The bill was introduced in May, and I'd like to, as I said earlier, to thank the Select Committee and to commend them for their work and the valuable recommendations. 13 individuals and organisations also made submissions. The committee had a number of amendments, which I thought I'd go through. The committee recommends, and the government agrees, that the bill should be amended to clarify the commencement date of the bill. This would mean that if the parts of the bill are not brought into force by order in council, it will come into force 6 months after the date that it receives the royal assent. This responds to the recommendations by the Regulations Review Committee. Secondly, in recognition of the readiness of district health boards, the Ministry of Health and the National Health Board to implement changes to the DHB planning framework, the Health Select Committee has recommended a change to the start date for the streamlined planning requirements to bring those forward a year, and the Government supports the recommendation of the Select Committee. The Select Committee has also recommended that we provide further clarification on the application of the Crown Entities Act to the new direction powers for shared services and the all of DHB direction powers, and the Select Committee's recommendation makes a lot of sense and the Government is supporting that too. Fourthly, in relation to the Health Quality and Safety Commission, the committee members make a number of recommendations relating to its objectives and functions, to which the Government also thinks are very sensible, namely that the Commission should take on the objectives and the functions previously performed by the National Health Epidemiology and Quality Assurance Committee, that was previously known as QUIC, and that where it is appropriate, the Commission be required to work with the Ministry, the Health and Disability Commissioner, providers, health professionals and consumers, and that the wording in the bill is amended so that the description of the Commission's functions are consistent throughout the bill. There were a number of public submissions, Mr Speaker, in relation to the mortality review committees that expressed support for the responsibility for the appointment of these committees transferring from the Minister to the Commission. The committee recommends and the Government supports this amendment. The details of the objectives, powers and functions of the mortality review committees are to remain the same. The committee also recommended a number of minor amendments to the bill to correct terminology, grammatical errors, remove unnecessary wording and ensure consistency. And finally, many submitters on the bill wanted to understand more about how and when district health boards will be required to consult with the public. And the Government is keen to promote public participation in DHB decision-making where it's effective, and as such the Government is proposing a set of planning regulations that DHBs will be required to comply with under the Act. These regulations will describe the details of the plans that they will be required to prepare and contribute to. They will include a requirement to consult with the public where the Minister considers that district health boards are proposing changes to service eligibility, access or the way services are provided that will have a significant impact on recipients of services, their caregivers or providers. Now actually that's quite a step forward from where we are at the moment. So the Government supports the amendments recommended by the Health Select Committee. Mr Speaker, it is important to understand that the bill isn't about major restructuring of our district health boards or the public health service. It is about the Government's desire to make sure that the system that we have currently works as effectively and as efficiently as it can in the interests of New Zealand patients and the public health service as a whole.
The question is the motion be agreed to.